Dr. Labadie, could you tell the jury what you do for a living?
Certainly. I am a forensic pathologist employed as an assistant medical examiner at the Wayne County Medical Examiner's Office.
And how long have you been so employed?
I have been at the office for almost 25 years, which is the entire length of my professional career.
And what is the field of forensic pathology?
That is the field where we study diseases and injuries and determine how they can cause or relate to death.
And what sort of training do you have to have the current position that you hold as an assistant medical examiner?
After graduating medical school, I have to do a residency in the field of anatomic pathology, and I did that at the Detroit Medical Center. At the completion of the residency, I then did a fellowship in the field of forensic pathology, and I did that at the Wayne County Medical Examiner's Office. And at the end of all of that training, I became board certified in two areas, anatomic pathology and forensic pathology.
And what does it mean to be board certified?
It means that I met the qualifications that the American Board of Pathology set forth, meaning that my training was in an accredited program and that I had satisfied all of the requirements. I then sat for an exam and I passed the exam and therefore am deemed to be board certified in the two areas.
And in terms of your career working as a forensic pathologist, how many cases would you say you've worked on in total, if you can estimate it, in trying to determine the cause and manner of somebody's death?
In my 25 years, I have performed well over 9,000 autopsies, as well as having to determine causes of death in individuals that we don't see the body in.
Okay. And let's discuss both of those circumstances. You mentioned performing autopsies is obviously part of your job.
Yes.
What is an autopsy?
An autopsy is the examination of the body. It consists of two parts, the external examination as well as the internal examination. And we are looking for identifying features, injuries, and diseases. We also have the opportunity to perform testing, like doing x-rays, doing genetic testing, doing laboratory testing, toxicology. So we have that ability.
And you mentioned also in some cases you're working on cases where you don't have a body. How much you go about looking at the cause and manner of death in a case where there's not a body?
So the cases that we're referring to are the deaths that are called into our office. We have around 21,000 deaths reported to our office each year. And we only bring in just under 4,000 of those individuals for an examination. The rest of them, if it's an individual, say an elderly person who dies in their sleep, and they haven't seen a physician in years, someone needs to complete that death certificate. In those cases, and we get them every day, we have to have knowledge of the age, their medical and social history, and the circumstances surrounding the death. In these cases, the person is known to be dead, and the body is at a location where the police can go and investigate and then determine if there's no evidence of foul play. And if all of that occurs, we then can complete a death certificate on a person who we have not examined.
Okay, and when you're completing a death certificate of someone you haven't examined, what sort of sources do you look to for information?
Certainly, again, we look at their age and therefore what are the most common causes of death for a particular age group. We want to know their medical history, their social history, specifically drug and alcohol usage, and then the circumstances, which would come from the officer at the scene. Is there any signs of foul play, any signs that the house had been ransacked, anything that would appear that it was anything other than a natural death?
Okay, and have you previously testified as an expert in the field of forensic pathology?
Yes, I have.
And can you say approximately how many times you testified?
It's been over 450 times.
And has any court ever declined to qualify you as an expert in the field of forensic pathology?
No.
With that, I'd pass any more here as to Dr. Labadie's expertise.
No questions.
Thank you. And so, Your Honor, I would just ask that Dr. Labadie be qualified as an expert in forensic pathology.
All right, and you received medical training then?
Yes.
Okay, and where did you do your medical training?
I graduated from Wayne State University School of Medicine. My residency was at the Detroit Medical Center, and my fellowship was at the Wayne County Medical Examiner's Office.
Based on your education, training, and experience, I'll qualify you as an expert in your forensic pathology.
Thank you, Your Honor. And Dr. Labadie, did you do some work in connection with an individual by the name of Zion Foster?
Yes, Detective Gilliman in March of 2022 had contacted our office seeking assistance with general knowledge about obtaining a death certificate and jurisdiction. As the senior and most experienced pathologist in the office, I took that call and answered the questions. It then turned out to be relating to this case, and I was asked a year later if I would be willing to review some materials and offer opinions in court.
Okay, and did you ultimately review some materials in connection with this case?
Yes, I had asked for copies of her medical records, as well as copies of a summary of the statements that were given regarding the circumstances surrounding her death. And that with that information, I could at least evaluate it for possible causes of death, and if possible, what would those deaths look like?
Okay, and in terms of the medical records, I'm holding what's been marked as proposed exhibit 56, Your Honor. It's a set of medical records from Henry Ford Health System for Zion Foster, and I'm looking for that under 902 subsection 11.
No objection.
Thank you. May I approach, Your Honor? And Dr. Labby, I'm handing you what's been marked as People's Exhibit 56. Can you just confirm briefly whether those are the records that you reviewed in connection with this case?
Yes, the records that I reviewed were roughly 630 pages from the Henry Ford Health System, spanning November 2016 through December 2021. And without going through each page, this indeed appears to be a hard copy of the records that I received.
Okay, you also mentioned that you received what you characterize as some summaries of some statements that have been made describing the alleged circumstances of Zion Foster's passing. Is that correct?
Yes, Detective Gilman had indicated that there were 4 statements given regarding the circumstances surrounding Zion's death, and I had asked for a summary in particular to what drugs were alleged to have been used, the time frame between the drug use and her taking a nap, and her behavior during that time frame. And I received a 2-page summary that was compiled by Detective Gilman of those 4 statements.
Okay, and at some point subsequent to that, did you have an opportunity to review transcripts of the statements?
Yes, in preparation for this trial, the prosecutor sent me copies of transcripts from the 4 statements. I read through them, and I believe that the summary that I had received and based my opinions off of were accurate.
And just to be clear, I want to make sure, when you say 4 statements, are you sure it was 4 statements?
I thought it was. I thought that there were 2 given to Sergeant Jones on the 19th, 1 on the 20th given to Lieutenant Lalone, and then 1 in June that was given to Sergeant Sullivan.
Okay, understood. As part of your work in connection with this case, what did you do with respect to those medical records that you're holding that have been admitted as Exhibit 56?
What I did was that I reviewed them and made notes about any conditions that she had, chronic conditions that were present during her yearly checkup and her problem list, visits that were for targeted reasons, and then I also made sure that I did research so that I fully understood these conditions and specifically how they could have caused her death.
Okay, and I want you to open up the records to the portion that's dated November 18th of 2016. Do you see, is there a visit reflected for that particular date?
Oh yes, on November 8th or 18th.
I'm sorry, is it, what did the record say?
It says November 8th.
Okay, I must have made a typo. So November 8th of 2016, was there a visit reflected for that date?
Yes, this was the date of a well-child visit or a routine checkup that was at Sterling Heights Pediatrics.
Okay, and other than the sort of indication that it was for a well-child visit or routine checkup, was there anything else in the documentation for that visit reflecting the purpose of the visit?
The thing listed in the diagnoses besides the adolescent visit was dietary counseling, exercise counseling, and then screening for anemia.
Okay. And in terms of the record associated with that particular visit, is there anything notable in that record?
No, there were no signs or symptoms, and there were no other indications of any other problem or any additional testing that was ordered.
Okay. And what's the date of the next visit reflected in the records?
That would have been January 24th, 2017.
And is there any indication in the records as to what the purpose of the visit on January 24th, 2017 was?
Oh yes, this was a visit again to Sterling Heights Pediatrics for a cough, sore throat, and a headache.
Okay. And do the records for that particular visit reflect any diagnoses?
Yes, she was diagnosed with strep throat.
Okay. And in terms of the record for that January 24th, 2017 visit, was there anything else notable?
No.
Okay. And what's the date of the next visit as reflected in the records?
This would be April 22nd, 2017.
And do the records indicate what the reason was for that particular visit?
This particular visit was to the emergency room, Sterling Heights Emergency Med, and she was kept for 1 day.
Okay, and is there any indication of whether there were any reported symptoms or diagnoses made during that visit?
Yes, she was seen for a cough and she was diagnosed with pneumonia.
Okay. But in any case, she was just kept for 1 day, is that correct?
Yes, or it was like an overnight situation. It may not have been a full 24 hours, but yes.
And in terms of the records for that April 22nd, 2017 visit, is there anything else notable?
No.
What's the date of the next visit reflected in the records?
The next visit is September 19th, 2017.
And do the records indicate what the purpose was for that particular visit?
This was again a well child visit, and again to Sterling Heights Pediatrics.
And do the records for that visit reflect whether there were any diagnoses made or any notable symptoms reported?
No, this again was a well adolescent visit, dietary counseling, exercise counseling, and apparently she received a sports physical.
And was there anything else notable in connection with that September 19th, 2017 visit?
No.
What's the date of the next visit reflected in the records?
We are now February 2nd, 2018.
And do the records reflect what the purpose was for the visit on that date?
Signs and symptoms of an upper respiratory infection.
Okay. And were there any diagnoses made in connection with that visit?
Yes, that she was suffering from a right ear infection.
Okay. Anything else notable in connection with the records for that February 2nd of 2018 visit?
No.
What's the date of the next visit?
February 25th, 2018.
And is there any stated reason for that visit in the records?
Yes, this was to Sterling Heights Emergency Medicine, and it was for a finger injury.
Okay. And was there any sort of diagnosis or other reported notable symptoms in connection with that visit?
No.
Anything else notable in the records for that visit?
No.
What's the date of the next visit?
February 1st, 2019.
Okay. And do the records for that visit indicate what the reason was for the visit?
Yes, this was to Fraser Family Medicine, and
Does it indicate what the reason was for the visit?
yes, this was to Fraser Family Medicine, and the reason was established care. But the diagnoses, if I can read them, would be a chronic migraine without aura, hyperreflexia, which would be flexible joints, as well as joint pain and chronic fatigue.
Okay. And was there anything else notable in connection with that February 2019 visit?
No.
What's the date of the next visit?
The date of the next visit was May 9th, 2019.
And do the records indicate whether there was a specific reason for that May 9th, 2019 visit?
Yes, she went for vomiting and an upper respiratory infection, and she was diagnosed with an acute upper respiratory infection.
Okay. Was there anything else in terms of diagnoses or reported symptoms at that time that was notable?
No.
What's the date of the next visit?
It is May 11th, 2019.
And do the records indicate what the purpose was for that visit?
This was to a walk-in clinic, and it was for a cough.
And was there any diagnosis made at that visit?
Yes, she had a sinus infection, and then she had earwax impacted in her ears that had to be removed.
Okay. Anything else notable in connection with that visit?
No.
What's the date of the next visit?
The date of the next visit was October 2nd of 2019.
And do the records indicate whether there was a reason for that particular visit?
Yes, for nausea, dizziness, headache, sore throat, and chills.
And do the records for that visit indicate whether there was any diagnosis made during that visit?
Yes, she had a right ear infection again and sore throat.
Okay. Anything else notable in connection with that particular visit?
No.
What's the date of the next visit?
The next visit is December 12th of 2019.
And do the records indicate what the reason was for that visit?
Yes, she went to Cottage Walk-in Clinic for an irregular heartbeat.
Okay. And do the records indicate whether there was any diagnosis made at that visit?
Yes, she had described the irregular heartbeat as sometimes her heart is racing and other times barely beating at all. On exam, the only abnormal finding was tenderness of her chest wall, and they did an EKG, which was normal. So her diagnoses were that the palpitations were due to anxiety.
Okay. And anything else notable in connection with that visit?
No.
What's the date of the next visit?
The next visit is June 16th, 2020.
And do the records indicate whether there was a reason for that visit?
This was a visit for nausea and vomiting.
And do the records indicate whether there was any diagnosis made at that visit?
The diagnosis is unspecified nausea and vomiting, so it appears that they didn't find a cause for it.
Okay. Was there anything else notable in connection with that June of 2020 visit?
No.
And what's the date indicated for the next visit?
Is March 10th, 2021.
And do the records indicate whether there is a reason for that visit?
Yes, this was a child visit or a well-adolescent visit.
Okay. And do the records for that March of 2021 visit indicate whether there was any diagnosis made at that time?
Yes, the diagnoses were that this was a routine visit without abnormal findings. She has chronic fatigue, vitamin D deficiency, Ehlers-Danlos syndrome, and then needing vaccines for school.
Okay. Anything else notable in connection with that visit?
No.
Is there, what's the date of the next visit in the records?
It is April 5th, 2021.
And is there a stated reason in the records for that visit?
Yes, this was a hospitalization and it was for COVID.
Okay. And does it indicate whether there was any diagnosis made during that visit?
Yes, she was diagnosed with COVID-19 infection as well as the Ehlers-Danlos syndrome unspecified
Okay.
appearing.
And does it indicate how long she was hospitalized?
She was hospitalized for 2 days.
Okay. And how about the date of the next visit?
Okay. The next visit was April 12th, so 5 days after she was discharged from the hospital. Trying to get them over, sorry. Okay.
And do the records indicate whether there was a stated reason for the April 12th, 2021 visit?
Yes, this was to an emergency room, and it was for continuing respiratory symptoms.
Okay. And the records indicate whether there was any diagnosis made at that time?
Yes, at this time she was diagnosed with pneumonia due to COVID.
Okay. Was there anything else notable in connection with the records for the April 12th, 2021 visit?
No, except that this pneumonia was treated as an outpatient. She was not admitted to the hospital for it.
And what's the date of the next visit?
The next visit was October 21st, 2021.
And do the records indicate whether there was a stated reason for that visit?
This visit was to family medicine for depression.
Okay. And do the records for that visit indicate whether there was any diagnosis made?
The diagnosis was anxiety and depression.
And was there any sort of anything prescribed at that time? What the records indicate?
She was prescribed Prozac or fluoxetine. The dosage was 10 milligrams per day.
Okay. And are you familiar with the prescription medicine known as Prozac?
Yes.
And what is Prozac prescribed to treat?
Prozac is fluoxetine, and it is prescribed as an antidepressant. Antidepressants are classified according to how the mechanism that they work in your body through. And fluoxetine is known as a selective serotonin reuptake inhibitor, an SSRI. And that is important when you're considering other diseases and whether they should be prescribed for them or not. And this is the lowest dose, or the starter dose for Prozac. The dosage can get much higher.
And can SSRIs like Prozac be used to treat anxiety as well as depression?
Yes.
And is it common in your experience for them to be prescribed to treat both anxiety and depression?
Jack, I believe this goes beyond her expertise. She's not a pharmacologist. She stated that she's a forensic pathologist, so I don't believe she would be well versed on some of these medications, on what the causes or particular ailments necessary for an individual to take these.
I'll lay more foundation on that.
Okay.
In your work as a forensic pathologist and as a trained medical doctor, do you have familiarity with prescription drugs?
Yes, but my familiarity is with how they might cause death or in combination with other drugs result in death.
And I guess based on that knowledge, do you have some familiarity with the prescription practices relating to certain prescription drugs?
With regards to Prozac, what I'm familiar with is that this is a starter dose versus one of the higher doses, and again, how it might interact with other diseases or drugs to result death. All I know is that I know that it is prescribed for anxiety and depression, but in what particular instance this versus another one, that's beyond my area.
Okay, understood. But I guess what I'm wondering is can Prozac be used to can Prozac be prescribed for depression and anxiety?
Yes.
And you mentioned the dosage that Ms. Foster was prescribed is how much?
10 milligrams per day.
And And what was it that you said about that particular dosage?
This is what the starter dosage is for Prozac. It can go up significantly higher for the total dosage per day.
And are you aware of, based on your medical experience, of any safety issues relating to Prozac?
Thankfully, no. Other types of antidepressants, there are some very serious contraindications for prescribing them, but the Prozac is considered a low risk with a lot of other conditions and medications.
Are you, in your work and in your training, are you familiar with whether there are possible side effects with abruptly stopping taking a drug like Prozac?
Yes, with all antidepressants, you would preferably not want to just stop cold turkey. You would want to have a physician taper them because you can experience withdrawal symptoms. For Prozac, withdrawal symptoms are not serious, they're just uncomfortable. It refers to general malaise and fatigue. But abruptly stopping Prozac doesn't cause any significant impact to your health. And with regards to the 10 milligram dose, stopping it abruptly would not even really give you withdrawal symptoms because it takes so long for the drug to be metabolized in your body that the drug is sort of, as it's being metabolized, self-tapering itself at that dose. If it was a higher dose, you definitely would want a physician to taper you down so that you aren't uncomfortable. But again, at the 10 milligram dose, the drug is basically, as it's leaving your body, self-tapering because it takes so many days for it to leave your body.
And in connection with this particular visit where the Prozac was prescribed, is there anything else notable in the records for that visit?
No.
And what's the date of the next visit?
The next visit is November 10th, 2021.
And is there any stated purpose in the records for that particular visit?
Yes, this was to an urgent care center, and she wanted an STD test.
And was there any sort of diagnosis made in connection with that particular visit?
I know she received the screening, but she must have not had any sexually transmitted diseases because there's none listed.
Okay. Anything else notable in connection with that visit?
No.
And what's the date associated with the next visit?
The next visit is December 22nd, 2021.
And do the records indicate whether there was a reason for that particular visit?
Yes, it was for a sore throat.
Okay. And is there any indication that there's any diagnosis in the records for that visit?
Yes, she was diagnosed with an upper respiratory tract infection and again, a right ear infection.
Okay. Anything else notable in connection with that December 22nd, 2021 visit?
No.
Any other significant symptoms noted?
No.
And are there any other records associated with in-person visits beyond that December 22nd, 2021 point?
No. Under what is labeled miscellaneous, we have what appears to be telephone encounters.
Okay. And as part of your review, did you look into those the records associated with the telephone encounters?
Yes.
And was there anything notable that you saw in terms of the telephone encounters?
No.
And just to be clear, would a telephone encounter just be a sort of documentation of somebody calling and having some kind of a consultation with a medical provider?
Yes.
Of some sort? Now, in terms of your overall review of those records, when looking at this particular case, was there anything that you saw that was notable or that stood out to you in those records?
No. She appeared to be an adolescent that used the healthcare system. I mean, she went for her well child and regular checkups, and the infections that she had are what are commonly seen in children and teenagers in the Metro Detroit area, and that there was nothing else that stood out. In particular, she did have a diagnosis of asthma, and that was consistently through the records, yet she never experienced any asthma symptoms or breathing symptoms or had any health visits relating to asthma. And the palpitations that were diagnosed and due to anxiety, that was almost 2 years before she went missing. And in those 2 years, there was no other visits for cardiac-related symptoms or palpitations.
Okay, and
Yes.
EDS, I'm sorry. And what is EDS?
That is Ehlers-Danlos syndrome. That's Ehlers-Danlos. It's commonly abbreviated to EDS because it is a mouthful to say. But this is a group of 13 inherited or genetic conditions that due to disorders of connective tissue, specifically collagen. And connective tissue is present in your eyes, your joints, your skin, your bones, your heart valves. And these 13 conditions, they are diagnosed on an exam and with genetic testing, and they can range from types that have are associated with a normal lifespan and really only involve the joints and the skin, to very serious variants that involve blood vessels and heart valves. And those are associated with a significantly shortened lifespan and life-threatening issues.
And I guess, was there anything that stood out to you about was it just one instance that was reflected in the records for Ms. Foster?
What stood out to me was the comment about her hyperflexible joint and joint pain was there, but the diagnosis of EDS, again, follows a very predictable path and involves genetic testing. And there was nothing in the records that indicate who did this, what the exam, what the genetic testing was, that her EDS was never subtyped, and it was not consistently through her medical record. So it was a condition that sort of appeared and then didn't. So this, to me, I don't honestly know if she actually had EDS, but whoever made that diagnosis would hopefully have more information.
Okay, and in terms of anything that you saw in the totality of those records, is there any sort of condition or symptom that might explain someone dying spontaneously from natural causes?
Going through the record, the only condition that could have resulted in sudden death or unexpected death in her would have been asthma. But asthma does not cause sudden death. You just don't die suddenly. You die in an asthma attack. And asthma attacks it's like you're being suffocated. So it's the antithesis of falling asleep. I mean, you are struggling to breathe. You're breathing fast. If you have your inhalers, you are using it. I think to every person observing someone in an asthma attack, it's clear that something is wrong and going on. And that was not any signs or symptoms that were in the circumstances that were given to me. So again, based on her history, the one thing that I think could have caused her death at 17, the circumstances did not seem to support that.
Okay, and when you talk about the circumstances, you're referring to the summaries of the statements that you
Yes.
reviewed. And so was anything in those statements, to the extent that you reviewed the summaries of the transcripts, consistent with an asthma attack?
No, there was no mention of any difficulty breathing or breathing quickly. The only comment relating to the breathing was that when she felt sleepy and took a nap, that her breathing appeared to be slowing down.
In your review of the medical records, did you come across any indication that Ms. Foster had been diagnosed with any sort of seizure condition?
No. At no point in the medical records was any seizure or seizure-like activity discussed or observed. There was no testing done for it. There's very specific testing that would be done to diagnose epilepsy. And so she never received a diagnosis, at least in the records that I received, of a seizure disorder.
Okay, and in terms of those records, were there any sort of reported symptoms that could have been consistent with a seizure diagnosis?
No, in the medical records there was nothing to indicate that she was experiencing seizure or seizure-like symptoms.
And are there different types of conditions that could cause one to have seizures?
Yes, if seizure-like activity is observed, that could be an honest seizure, and there's many different types of seizures, some that involve your awareness, others involve body movements, but seizure-like activity could also represent an underlying cardiovascular problem. It's not that you're really having a seizure, but that temporarily your brain is not getting enough blood because of underlying issues, and that is resulting in what looks to us like a seizure.
And do you have any familiarity, based on your medical training, what like a typical seizure might look like in terms of symptoms while someone's experiencing it?
Again, there's a lot of different conditions, and they can range from what is known as an absence seizure, which is when you just sort of space out for a moment or two and then you snap right back to it, to what people know as grand mal seizures, where you are full on thrashing around, and lack for a better term, you're going to be concerned about them swallowing their tongue and making it through the actual seizure.
Okay, and you mentioned an absence seizure. Hypothetically, if somebody just spaced out for a second or two and then sprang right back to it, could that be consistent with an absence seizure?
Yes, absence seizures are one of the most common types of seizures in children, and one of the main reasons why their performance in school might not be that great. They're, like the teachers will say, they're daydreaming a lot. The hallmark of the absence seizure is that it lasts for a very short period of time, and as soon as it's over, there's no confusion or post-ictal state like there is with other types of seizures. It can be also associated with focal body movements, like some movements of the mouth or the eyes or the hands, but the key is really a very short duration, and you don't, when it is over, you have full awareness of where you are and what's going on.
And Are you aware of absent seizures being able to cause someone to die suddenly?
According to the Epilepsy Foundation, absent seizures are not associated with sudden death. When you have epilepsy, all types except absence, you can die in a seizure, or you are at an increased risk for sudden death. It is a sad fact of epilepsy. But absent seizures, there is no risk of dying in a seizure. There is no increased risk of sudden death. The problem with absent seizures would be if you were swimming or driving or operating heavy machinery when this type of seizure is occurring. You might get into an accident or a difficult situation because of the environment you were in when you had it.
And you also mentioned like a grand mal seizure. Would that be sort of the more prototypical seizure with more apparent symptoms that I think you would expect to see?
Yes. Again, there is a lot of different types of seizures where only one part of the body might move. The entire body, whether you know that they're coming on or not, the length of the seizure. These little focal space outs can also happen with other types of seizures. This is why it's important if you're having seizure-like activity to go to the doctor and get diagnosed so that if it is a part of a much more worrisome seizure, that can be addressed.
And in terms of those more serious seizures, are more serious seizures potentially associated with sudden death?
Yes. Again, all except the absent seizures are, you do have an increased risk of sudden death, which means that you die suddenly but not while having a seizure. And in epileptics, the risk of that is actually 1 in 1,000.
And in terms of the materials that you reviewed, both summarizing the statements and the transcripts of the statements, did you see any descriptions from the supposed circumstances of science passing that were consistent with either an absent seizure or a more serious type of seizure?
No, there was nothing that I reviewed or received that described anything either from a space out to something that would look more like a traditional seizure. In short, there was no behavior that was described or recorded to the police that described the seizure.
Okay. Did you look into issues surrounding drug use as potential explanations for sudden death in this case?
Yes, drug use and abuse is one of the most common causes of death in teenagers. In this case, because there was drug use that was being admitted to or alleged. So yes, we definitely considered drug use and abuse as a cause of her death.
And as part of that consideration, did you think about marijuana and whether that could have caused Zion Foster to die suddenly?
Yes, the statements all said that she used marijuana. The statements were inconsistent as to whether it was her marijuana mixed with the defendant's and if they shared paraphernalia. But all the statements were consistent. And marijuana does not cause death. You cannot overdose on it, and it doesn't bring about any adverse or potentially serious effects in the body.
How about LSD, or the drug commonly known as acid? Did you consider acid as a possible cause of sudden death in this case?
Yes. One of the statements stated that Diane took 1 tablet of LSD. Another statement denied that. But LSD is like marijuana in that you cannot overdose on it, and it is not associated with any serious life-threatening effects to your body.
And did you look at other controlled substances as potential causes of sudden death in this case?
Yes, although opioids were not mentioned in society today, you would be remiss if you didn't always consider opioids as a possibility.
And could you describe, just as a general matter for the jury, what are the sort of class of drugs known as opioids?
Opioids would contain fentanyl, which is the big one that's on everyone's mind, as well as pills like if you are prescribed Percocet, oxycodone. It is pretty much, opioids refers to opiate-like substances that are not morphine and are not heroin.
And obviously, unlike marijuana and LSD, is it possible to overdose from and die from opioid use?
Yes. Opioids, whether you take it yourself or if you're concerned about drugs being laced with it, and I'm referring mostly to fentanyl because that is predominantly what is out there right now. If you are not habituated to the effects of fentanyl and if you don't know that you're taking it, you can certainly overdose and die. Fentanyl its peak effect takes hold in just a few minutes. So those people who are not used to taking it will fall asleep or collapse almost immediately after using it. And that's, again, just because that fentanyl only takes a few minutes for it to be its peak effect. The effect of fentanyl will wear off in about an hour. And the signs and symptoms that were described, and in particular, there was a passage of time in all of the statements between the drug use and her death. And with that passage of time, that meant that fentanyl could not have caused her death because, again, she would collapse almost immediately after using it and not an hour or two later.
Okay, and just to be clear, the sort of descriptions of the defendant's statements that you received about the supposed circumstances of Zion Foster's death, were those at all consistent with an opioid-related death?
No, all of the statements had indicated that there was a passage of time between the uses of the drug and her taking a nap or becoming unresponsive. And that passage of time would be inconsistent with her using fentanyl.
And how about pills like Percocets? Would that same sort of thinking apply to a death from opioid-related pills?
Yes, Percocet is oxycodone mixed with acetaminophen, and there are two preparations. One is a like immediate release, and the other is a controlled or sustained release. But all of the opioids are very consistent in that their peak effect happens relatively quickly, and they don't last in the body all that long. So all of the opioids that we could consider, given again the passage of time that was in the statements, would make the opioids not a very likely cause of her death.
Okay, and based on your review of both the summaries of the statements that you received about the defendant's statements and the transcripts of those statements themselves, can you opine as to whether there's any sort of medical plausibility to the claims that were made about Zion's passing?
Well, the comments did not make any medical sense when trying to consider why an asymptomatic, otherwise healthy 17-year-old would die suddenly. The conditions that could have resulted in her death, like the asthma, the circumstances that were described, did not fit. If she was having a cardiac event, she would have been experiencing palpitations, chest pain. That was not in the circumstances. The drugs that she was known to have used, the LSD and the marijuana, could not have caused her death in any way. Other drugs like the opiates, the time frame that was described in the circumstances did not make sense. So in other words, the behavior that was described in the passage of time does not make sense in why she would have died.
Okay, and if at the time that you had completed your analysis, you had heard additionally, hypothetically, that at one point in time, Zion had essentially passed out for a second or two, but you had no other information about that episode, would your overall conclusion have changed?
No, if she only passed out once, albeit briefly, that could be an absence seizure or it could be related to something else. There was at no point in the medical records that I received was there ever a diagnosis of a seizure disorder. Admittedly, if there was one, if she had been diagnosed and it was a type other than absence, then most definitely she could have had a seizure. She could have died. She could have died from sudden death because of that condition. But I did not receive that information.
And in terms of your overall experience and all the thousands of cases you've worked on, have you ever seen an otherwise healthy child die from a seizure?
In children that have a diagnosis and a subtype and are on medication, unfortunately, yes. They can die while having a seizure, or they could just be found dead in their bed. But epilepsy is not something that we can diagnose after death. It's abnormal electrical activity in your brain, and when you're dead, your brain no longer has that activity. So it would have to be a condition that was diagnosed in life. And so, yes, I have seen cases of that in children with a known diagnosis.
And in terms of the known diagnosis, would that be would you characterize as a serious seizure disorder?
It could be anything other than absence, because again, they're all associated with sudden death. Obviously, the more serious in terms of the length of time and the deficiencies and defects that you have while having the seizure would your suspicion for dying from it go up. But again, any seizure except absence, that could unfortunately happen.
Okay, and did you at some point reduce your analysis in this case to a letter?
Yes, after I received the materials that I asked for, and we had a conversation with the prosecutor, he asked if I would be willing to put my opinions into a letter addressed to the Wayne County prosecutor, and I said yes. And so I believe the letter is dated June 5th of 2022.
Okay, and I'm holding what's been marked as proposed exhibit 57. May I approach, Your Honor?
Yes.
Dr. Labby, does proposed exhibit 57 appear to be the letter that you drafted offering your opinion in this case?
Oh, yes, and I apologize. The date was June 5th, 2023. I was off on the year, but yes, it is a 3-page letter, and yes, this is a copy of it.
Okay. Your Honor, I would move to admit proposed exhibit 57.
No objection.
Thank you. And when you drafted this what was your sort of baseline conclusion?
My baseline conclusion is that her cause of death is unknown. In a case like this, an autopsy and hopefully toxicology would need to be done to sort out what happened in her final moments. Looking at the medical history and the alleged drug use and the circumstances that I was given, there appears to be no obvious or likely cause of death. Then looking at the most common causes of death, for every age group we always have to consider what is most common. And for teenagers, if they have survived childhood with the childhood cancers and syndromes, they have a relative grace period with regards to diseases until the mid-20s when the acquired hypertension and diabetes start catching up to you. So teenagers, their most common causes of death are a lot of traumatic ways: firearm injuries, motor vehicle accidents, drowning, fire, suffocation, as well as drugs, cancers, heart disease, lung disease. And looking through her medical history and the circumstances that were given to me, all of those causes were excluded except suffocation and forms of violence, including firearm injuries.
Okay. And today, obviously, you've received some additional information about the alleged episode of Zion passing out at one point.
Yes.
And with that additional information in hand, does that change or impact your analysis from this original opinion that you had?
Again, my opinion would change if there was an actual diagnosis and a subtype known. So in other words, she was officially diagnosed with a type of epilepsy. Then yes, that could have been a cause of death for her. In the absence of that, no, I would still say that the circumstances and what we know doesn't explain why she died.
Okay. And you mentioned one type of death that is left open would be suffocation.
Yes.
Have you done autopsies in cases where the deceased has been suffocated?
Yes. Suffocation just means that you're not getting oxygen into the body, and you can suffocate by smothering, by having your nose and your mouth blocked. You can suffocate if you were strangled, so there's pressure placed on your neck. You can also suffocate if you hang. So there's multiple ways that you can bring about suffocation or asphyxiation.
And in your experience and in your training, would a suffocation death necessarily produce blood from the victim?
No. A lot of to do with suffocation is dependent on the struggle. The act itself of just blocking the nose or mouth or putting pressure on the neck, you're not breaking the skin, you're not creating a wound in which the blood in the body can leave. So it all comes down to struggle. If there is a struggle and there's a lot of contact between the assailant and the victim, some blood might be produced that way. But if the victim is very quickly overcome, then there won't be a struggle and you could expect to see no blood anywhere.
And if hypothetically, even as late as today, Zion Foster's body was found, would having access to her body even at this point have been helpful to you in terms of determining a cause and manner of death?
Absolutely. Any portion of a body that we can recover, even if it's just a few bones, that can provide us with some information. For instance, a few bones, we can get DNA off of that to positively identify. We might be able to make bone dust and get some toxicology results. We can also examine the bones for injuries that might have occurred before her death, as well as any injuries that occurred after due to the compaction and the process of how her body was disposed.
Okay. And in terms of making a determination of whether an injury is something that's coming from before death or after death, what kind of goes into that analysis?
The injuries look completely different. Injuries that occur before death, when you have a beating heart, have what we say is a vital reaction. So these injuries look like wet, moist, hemorrhagic. If we look under the microscope, we can see cells there, so we know that that injury occurred when your heart was beating. Injuries that occur to the body after death are very bloodless and very dried out. So we can look at them, at the injuries, both with the naked eye and under the microscope, and we can tell the difference between injuries that happened before you died or injuries after.
And so hypothetically, even if Ms. Foster's body had been placed in a trash compactor and was recovered after that, would you have still been able to determine the difference between injuries before and after death?
Yes, we have We have had other individuals who were put into a trash compactor or had slept there and inadvertently got compacted. And yes, we were able to tell the difference between injuries before life and after, or that there were no injuries before, but that we could get toxicology results and thus understand what happened.
Thank you. Any further questions?
Yes, thank you. Good afternoon, doctor.
Good afternoon.
Now, when you did your analysis was premised on information that was provided to you, correct?
Yes, on the medical records and on the summary of the 4 statements, yes.
Okay. And you testified at a preliminary examination, correct?
Yes.
Okay. And at that preliminary examination, you were posed with the question of whether or not you knew Zion Foster was taking antidepressants, correct? And at that point in time, you indicated that no, you were unaware of that, correct?
Yes.
Okay. And that information is provided in the medical records, correct?
Yes.
Okay. Had you reviewed the medical records prior to you testifying at the preliminary examination?
Yes, the records that I had received did not have medication lists in it, so I did not know that she had been prescribed any of the medications.
Okay. And when you gave your opinion letter in June of 2023, this predated your preliminary examination, correct?
Yes.
So at that particular time when you did your analysis and your opinion letter, you did not have the list of medications that Zion Foster was taking, correct?
Correct. The only medications that I knew of at that time were the asthma inhalers.
Okay, so it'd be fair statement that your analysis or opinion was based upon incomplete information.
Yes.
And also the time you made your analysis, you were unaware that Zion Foster had a history of seizures, correct?
Correct.
Okay. And to this day, you don't know whether or not what medication she was taking, correct?
Correct.
Okay. Did you request such information?
Yes, I had requested her medical records from all of the hospital systems, and what I received was what I had received.
Okay. And when did you receive the updated medical records that would contain the medications that she was taking for antidepressants?
That is sitting right here on the stand. When I was going through the hospitalizations, medication lists were in this set of records, and that is where I saw the fluoxetine.
Okay. When did you review that?
Oh, I didn't. When I was sitting here on the stand and I was asked to flip through it and then say what was in them. That was the first time that I saw.
Oh, that was the first time? So today is the first time that you realized that she was taking antidepressants?
Correct. Yes.
Okay. And do you administer Prozac?
No.
Okay. So you're not an expert as far as the side effects, how it may affect a certain individual, correct?
I am familiar with the side effects that could cause death, but side effects that would affect, like, say, mood or behaviors, that is beyond my area.
Okay. And just how long does Prozac persist in an individual's body?
Prozac has a half-life of 4 to 6 days. Half-life is the length of time it takes for a drug to leave your body by 50%. And by 4 half-lives, the drug is considered to be completely out of your system. So it would be 4 times 4 would be 16 days at least before Prozac was completely out of your system.
Okay. And that taken in conjunction with other medication could have adverse effects, correct?
It certainly could, yes. And if there were illicit drugs being taken along with prescription drugs, that could prove to be problematic.
Okay. Now, you mentioned that she was diagnosed with Ehlers-Danlos syndrome, correct?
Yes.
Okay. And it'll be fair that you stated that this particular syndrome can have life-threatening cardiovascular complications, correct?
Yes, because it can affect blood vessels and heart valves. It can be associated with serious life-threatening cardiovascular symptoms.
Okay. And there was no indication in her medical records that this particular syndrome no longer persists in Ms. Foster. That'd be a fair statement, correct?
Well, again, it was inconsistently listed in her conditions. So all that I know was that she wasn't experiencing signs or symptoms or going to the hospital because of her EDS.
Okay. And just to be clear, there's nowhere in her medical records that would indicate that this particular syndrome no longer persists, correct?
Correct.
And you stated that this particular syndrome could be a cause for sudden death because it affects the cardiovascular, which is the heart. Is that correct?
Yes, and blood vessels. But
Okay.
yes.
And if somebody went to the hospital complaining that they could barely feel their heartbeat, that could be an indication or a symptom of this particular syndrome, correct?
Yes, the visit for the palpitations could have been a symptom of the EDS. She did not have that diagnosis at that time.
Okay, but it could have been a symptom of that, to be clear, right?
Yes.
Okay. Now, did you ever do a follow-up opinion letter when you were, I guess, confronted with the information that there could be possible seizures involved in Ms. Foster?
No. I was asked questions by counsel during the preliminary exam, but no, I did not follow up or change my opinion letter after first hearing about seizures.
Okay. And when you say by counsel, you mean myself, correct?
Yes, correct.
And it would be fair that you were never asked questions by the prosecutor about seizures at the preliminary examination, correct?
That is correct.
Okay. And it would be fair that the prosecutor never contacted you and asked, could you provide a different opinion in conjunction with the information about her having seizures? That'd be fair, correct?
That would be fair, yes.
Okay. And also, there was never a request to you by the prosecutor to, I guess, formulate an opinion with the information that Ms. Foster was taking antidepressants. That would be a fair statement, correct?
Correct.
Okay. And that information was never provided to you by the prosecution or the police that, in fact, Ms. Foster was taking antidepressants prior to today, correct?
Yes, again, during the preliminary exam, you asked me questions about antidepressants, but prior to that, I had no knowledge, and since that, until sitting here, I did not have definitive proof that she was on any antidepressants.
Okay. Now, you spoke about a absent seizure, which, in your opinion, is the least severe type of seizure individual would have, correct?
Yes.
Okay. And would it be fair to say that other more severe seizures could, I guess, be unnoticed to an untrained eye?
Well, I would say that we're talking about activities that don't appear normal, spacing out or jerking or having rhythmic movements. That's what all of these seizures have some variation of. So I would say that that's observable.
Okay. So it'd be fair that an individual could space out and have a more severe seizure symptom or category than an absent seizure, correct?
Yes, the space out can occur with other types of seizures, and so it therefore could be part of a more serious condition.
Okay. And had you had information that at one point in time somebody observed her having a blackout or type of situation, and they were aware that she had previous other symptoms or seizures, would that possibly dictate or change your opinion of a possible cause of death?
Well, yes and no. Again, we need an official diagnosis of epilepsy to truly consider it. These episodes that have been described may be seizures, may be absent seizures, maybe other types of seizures, could be relating to cardiovascular disease. My answer would be that if she has been diagnosed and it's with epilepsy other than the absent seizures, that could explain her death. Without that diagnosis, we're just speculating, and I can't say that it then was actually a seizure or contributed to her death.
Okay. If she stated that she had a history of seizures and was taking medication for it, would that go into your analysis on whether or not this could be a possible cause of death, if you knew that information?
That information, then we would have to track down who made the diagnosis, what medication, who prescribed it, where was that medication filled, to try and get that history that seems to be lacking in the medical record.
Okay. And would it be fair that a person who has untreated symptoms, they're not taking medication for it, could that make the symptoms much worse if they're not taking medication for it?
Yes, if you are supposed to be on anti-seizure medication and are not taking it or not taking it as prescribed, you are at a greater risk for having a seizure and dying from seizures.
Okay. Now, some of the pre-ictal symptoms of a seizure would be a headache, correct?
That would be the aura, which could be the sense that you know a seizure is coming on, and a headache could be that feeling. The ictal refers to, at least in my understanding, the post-ictal is the period after the seizure where you are confused and you momentarily don't know what's going on.
Okay, and so pre-ictal would be before the seizure, correct?
Okay, yes.
Are you familiar with that term?
Yeah.
Okay. And also, some signs or pre-ictal signs prior to a seizure could be fatigue, correct?
Yes.
Okay. Now, fatigue and headaches could be symptoms of a person who is epileptic, correct?
Yes.
Okay. And if they go constantly to the hospital with these particular symptoms, it's possible that they were just undiagnosed for having seizures or being epileptic. Would that be fair?
Correct. If they're not suspecting it, when it's not typical seizure behaviors, it can be misdiagnosed or the diagnosis could be delayed.
Okay. And you would agree that no two seizures are the same, correct?
Well, correct.
Okay. So as far as typical symptoms, somebody may exhibit other symptoms that another individual may not exhibit. Would that be fair?
Correct.
Okay. And this could go for anything that's above absent seizures, correct?
Yes.
Okay. So somebody could have a life-threatening seizure and exhibits different symptoms than somebody else who's also having a life-threatening or life-ending seizure, correct?
Yes.
Okay. In some of these seizures, somebody could have a life-threatening seizure where the symptoms may persist for a few seconds. Would that be fair?
Yes.
Okay. And hypothetically, somebody could have a life-ending seizure in the amount of time it would take somebody to leave the room, get something to drink, and come back in there, correct?
Yes, correct.
Okay. Now, you didn't have an opportunity, of course, to examine Ms. Foster prior to the date, correct?
Well, yes, I mean, I've never examined her in life or her remains, correct?
Okay. So you wouldn't be able to be in a position to say whether or not she was asymptomatic at certain times of certain ailments, correct?
Correct.
Okay. And on this particular day, you wouldn't be in a position to say whether or not she exhibited certain signs for a seizure that was more severe than an absent seizure, correct?
That is correct.
Okay. Now, you indicated that you read a summary that was provided by the detective of the statements, correct?
Yes.
Okay. Now, when did you actually read the actual statements?
Yes, in last week in preparation for this trial, the prosecutor sent me a transcript of the statements.
Okay. So when you made your opinion in June of 2023, you had not had read the full summary, well, not the full summary, but the full reports at that particular time.
That is.
Now, you also stated that in today's society, you have to incorporate opiates in your analysis, correct?
Yes.
Okay. And would it be fair to say the reason because of that is that in some incidences, there's an inadvertently, I guess, consumption of fentanyl? Or it could be.
Yeah, in a lot of situations, we don't know. There are people who are known to use drugs, prescription or otherwise. But yes, fentanyl seems to be very pervasive in our society.
Okay. Have you ever been, I guess, seen a particular case where there has been marijuana that has been laced with fentanyl and somebody may have consumed that without them knowing?
Yes, that is a possibility.
Okay. And is it also a possibility that an individual could have been regularly consuming marijuana laced with fentanyl, and then to a particular time they consume more than they normally do and overdose?
Yes, that's a possibility too.
And is it also, I guess, a fair statement that if somebody was regularly consuming marijuana with fentanyl, they would build up some type of tolerance, correct?
Yes, it would take higher doses and more doses for them to feel the effects.
Okay. And an overdose, that would affect somebody's breathing?
Yes, an opiate overdose is fairly characteristic. The person becomes unresponsive and their heart rate and their breathing slow down until they stop.
Okay. And if somebody was experiencing a life-ending seizure, would it also be similar symptoms such as difficulty breathing or shallow breathing and a faint heartbeat?
It certainly could be, particularly toward the end of the seizure. If you're dying in a seizure, eventually, yes, your heart will slow down and stop.
Okay. And would it be fair that every seizure is different? A life-ending seizure could only persist 30 seconds or less, correct?
I would assume that they would take longer than 30 seconds. You need to have at least a couple minutes of your brain not getting oxygen in order for your brain cells to die. So I would say, but it could happen within a few minutes.
Okay. And when you hear, I guess, the symptoms of a faint heartbeat and barely or shallow breathing, to you as a trained expert, that means that somebody could be or is close to death, correct?
Yes, that would be a description of someone who is dying and close to death.
Do you know if Prozac is a tricyclic antidepressant?
No, Prozac again is the SSRI. Tricyclic antidepressants they act by a different mechanism.
So Prozac is not one of those?
Correct.
Okay. Had you had an opportunity to review her whole medical records to determine whether or not she was under a triglyceric antidepressant?
Again, the records that I received did not have medication lists, and in what I reviewed while I was testifying, I only saw fluoxetine.
Okay, so it'd be fair that you haven't had enough time to rule out whether or not she was on a triglyceric antidepressant, correct?
Correct. I clearly have not received all the records in order to do that.
And would it be fair to say that a triglyceric antidepressant could trigger seizures in an epileptic individual?
Yes, if you do not have epilepsy, the tricyclic antidepressants will not trigger a seizure, but if you do have epilepsy, they can trigger them or make them longer or make them worse.
You also stated that she was diagnosed with COVID.
Yes.
Now, from your experience, a lot of individuals died from COVID-19, correct? And some individuals had heart issues that were caused by COVID-19, correct?
Yes.
Okay. And you're not in a position to rule out whether or not COVID-19 could have been a contributing factor in somebody who already has a pre-existing cardiovascular issues.
In order for that to be an option, you would still have to be COVID positive and have documented signs and symptoms relating to that since the time that you were sick. In this case, she had the diagnosis and she had the pneumonia, which resolved, and she had no other signs or symptoms relating to it.
Okay.
So I would say in her case, know that if she was having cardiac symptoms or heart disease, it would not be due to COVID.
Okay, and it'd be fair to say that you have no documentation that she ever tested negative for COVID-19 after testing positive, correct?
I honestly don't know. In the records I had, there was no follow-up COVID. I don't know whether she actually did have follow-up COVID tests or not.
Okay. And you would agree that during COVID-19, a lot of individuals died who were, in fact, asymptomatic, correct?
That would really be no. In all of the COVID deaths that we had within Wayne County, they were symptomatic, whether acutely ill or had documented long COVID signs and symptoms. To just spontaneously die and have it be due to COVID was not the case, is not the case.
Okay, so there was never any, I guess, conversation or literature that was put out that individuals were asymptomatic of COVID-19.
They could be asymptomatic and die, but then they would have died from something else. If you were asymptomatic, you would not have died actively from a COVID infection.
Okay. With COVID, if you have a COVID infection, it could make a pre-existing condition worse, correct?
Yes.
Okay. Such as an individual who's diagnosed with Ehlers-Danlos syndrome, correct?
Yes. Anytime you have a syndrome like EDS, you want to stay clear of all infections because that can make things worse. So by her having COVID, if she actually had EDS and it was diagnosed at that time, definitely an infection could have made that worse.
Okay. And the same for pneumonia. It could have made that syndrome worse too, correct?
Yes, except that her pneumonias were all treated as an outpatient and they resolved. So I would think that would be very unlikely in her case, unless she died while she was actively having pneumonia.
Okay. But the fact that she was treated as an outpatient doesn't lessen the probability that pneumonia could make Ehlers-Danlos syndrome worse.
True, but it wouldn't be a long-term worse. It would be worse while you were actively sick. So while she had pneumonia, it could have made her conditions worse. But once you heal and the pneumonia's gone, then its effect on something like EDS should no longer exist.
And you also indicated about potential asthma. So asthma attack could be a cause for sudden death also, correct?
Yes.
Okay. And you said that they would have symptoms
Yes.
associated with that asthma attack,
Yes.
correct? Would it be fair to say that every asthma attack is different?
That is true, but the hallmark of them is that you are trying to get air into your lungs when it feels like you can't. So it's a struggle. So whether you will be hyperventilating or coughing or complaining of chest pain, but an asthma attack is not asymptomatic.
Okay. So in every asthma attack is somebody like wheezing or?
Might be. You could be coughing, you could be wheezing. Those details might differ from person to person, but this is where you are actively struggling to get air into your system.
Okay. Could it be shallow breathing?
Shallow breathing only if you are dying from your asthma attack. The shallow breathing is a function of you unable to get the air into your lungs and you are dying, not necessarily the start of the asthma attack itself.
Okay, so it could be the end of asthma attack as far as shallow breathing, correct?
Yes.
Okay, and would it be fair that no two asthma attacks last the same duration, correct?
Yes, correct.
Okay, and would it be fair that a life-ending asthma attack could, I guess, persist in a matter of seconds?
Again, no. It always takes at least a few minutes because that's how long your brain cells can last without oxygen. So you can be in attack for several minutes and then survive. It's when you have these attacks or episodes where it lasts longer than that. So now your brain cells have been without oxygen for a critical length of time. So I would say you can't die in seconds in an asthma attack, but you could definitely die after minutes.
Okay, and if somebody was hypothetically sleeping and they had an asthma attack and or seizure, we'll do asthma attack first. Somebody was sleeping and they had an asthma attack. Might they not exhibit the same symptoms as an individual who was awake?
You would wake up because you can't breathe. So again, it's a very active struggle to breathe type of look. So yes, you would wake up. You wouldn't just die in your sleep in an asthma attack. You would wake up and be struggling.
Okay. And in regards to a seizure, if somebody was asleep and they had a seizure, a life-ending seizure, may it have different symptoms than an individual who was awake?
Yes, again, with the exception of absence seizures, you can die in a seizure or it's sudden death, which is most instances you are just dead in bed. There's no evidence that you died while having seizure activity. So yes, when you are asleep, you can die from seizures and have it appear like nothing.
Okay. And you indicated that the way to detect if somebody is prone to epilepsy or have a history of such, then you would have to test their brain waves, I'm sorry.
Yes,
Correct.
Epilepsy is diagnosed on exam, laboratory tests, which include an EEG, which does look at the brain waves, and that can only be done when you're alive.
Okay, so to be fair that if you're presented a body, if somebody died because of a seizure, there's no way that you would be able to determine whether or not that individual actually did die of a seizure, correct?
Correct. There are no autopsy findings of seizure. This is why the history before death is so important. If we do have that history, the autopsy is really to rule out other reasons why you died.
Okay.
And if we can do that, there's no other diseases, there's no drugs, and you have a history of epilepsy, then we can conclude that that's what you died from.
And in a situation where it may not have been documented that somebody had a history of seizures and you're presented with a body and you do an autopsy, then you wouldn't be able to even come to the conclusion that they did die of a seizure, correct?
That is correct.
You also stated that, I guess, cardiovascular issues could cause seizures, correct?
Yes.
Okay.
Or behavior that looks like seizures to everybody.
Okay. And Ehlers-Danlos syndrome is a condition which could cause seizure-like symptoms to the untrained eye or trained eye, correct?
Well, certain variants of it have the vascular, the heart and vascular component. So if she's dying from one of those related issues, the behavior that you see might resemble a seizure. But EDS by itself doesn't cause seizures or, in the absence of cardiovascular symptoms, produce seizure-like activities.
Okay. So in conclusion, it's very possible that an individual who had a history of seizures could have suddenly died a 17-year-old, 18-year-old individual could die of a seizure if they had a history of it, correct?
Yes, correct.
Okay. And just to be clear, had you had that information, you would have reduced that to writing in your report, correct?
Yes, if I had the documentation of that, I would have included that in the likely scenario or not, depending on what the medical records actually showed.
Okay. In the summary that you read, the symptoms of faint heartbeat and shallow breathing or difficulty breathing could be consistent with a life-ending seizure, correct?
Correct. Or it's the common pathway to any life-ending event. Eventually, you are unresponsive and your heart slows down until it stops.
Just to be clear, it could be consistent with a life-ending seizure, correct?
Yes.
Okay. Thank you. No further questions.
Yes, Your Honor. I want to publish a couple of documents briefly. I just want to be clear, Dr. Lavey. So in your report that is admitted as Exhibit 57, what's the final sentence of this first paragraph read?
The other file was a 638-page copy of Zion Foster's medical records in the Henry Ford Health System.
Okay, and just then showing Exhibit 56, the set of medical records, how many pages are reflected here?
Here, 638.
Okay. I guess what I'm wondering, and I've got this up to page 495, and you see some discussion of medications here. Is that correct?
Yes.
And this would be from December 12th, 2021? Or December 22nd, 2021, I'm sorry. Would that be correct?
Yes.
Is it possible in your initial review that you just missed this?
Objection, that's leading.
Well, I'm asking because I'm confused about this.
Overruled.
Certainly, when I reviewed this, I did not see any medications or the fluoxetine listed. I did not memorize all 638 pages of her medical records. So if that is in my copy, then yes, I completely missed that it was there.
But just to be clear, you reviewed a 638-page set of records, correct?
Correct.
And this exhibit is a 638-page set of records?
Yes.
There was some discussion about the summaries of the statements that Detective Gilliman provided to you. In reviewing the actual transcripts of the statements, were there any material differences that you saw between the two sets?
No. Again, the only information that I was interested in is what drugs were allegedly used, the time frame between the usage and her becoming unresponsive, and her behavior during that time. When I reviewed the transcripts of these statements, the information regarding these issues were identical to the two-page summary that I had received.
And just to be clear, your analysis was sort of limited to those summaries that you received and this set of medical records. Is that correct?
Yes, correct.
And would it have been relevant to your analysis if you heard that the defendant had a deep, bloody gash on him the night that Zion Foster disappeared?
Objection, Your Honor. How is this relevant to first of all, this goes beyond the scope of cross, and I don't see how it's relevant to her testimony at all. It's definitely beyond the scope of cross.
How is this beyond the scope of cross? I mean, he's been asking hypothetical after hypothetical after hypothetical for the last hour.
I've been asking hypotheticals about what could have happened, just like he was asking hypotheticals if somebody had this condition or this condition. But as far as what's allegedly on somebody else, I believe that goes beyond her testimony, definitely beyond the scope of cross.
Okay. I'll analyze some retest.
Would it have been relevant for your analysis if you had heard that the defendant had a large, bloody gash the night that Zion Foster disappeared?
While that information might have been a red flag for law enforcement, since I didn't have a body to examine and an autopsy, any injuries on anybody else, I cannot put into context. If I had a body and I could do an autopsy and I knew that there was a stab wound or blunt force trauma, then yes, any injuries that could possibly be on someone else could indicate a struggle. But without a body to examine, I can't say anything about injuries on anybody else.
Okay, and in terms of your review of the descriptions of the supposed circumstances of Miss Foster's passing, especially in connection with all the questioning about seizures, would it have been relevant for you to know that the defendant himself claims to have had seizures?
I think
Objection. This is irrelevant. Like, Your Honor, this is irrelevant to her analysis and her testimony, whether or not any condition my client possibly had. I don't see that relevant.
How is it relevant?
Because wouldn't you think that would be the first thing that the defendant would have said in one of these 4 different statements that he told the police?
Your Honor, this is beyond her expertise, Your Honor.
All right, just a
Okay. Now, in terms of this discussion about seizures, would it be relevant for you to know that Zion's mother testified that she was aware of no seizure-like symptoms?
that information, and if assuming that the mother spends a lot of time around her children, would speak to the frequency of any seizure-like activity. If she hasn't noticed any and she spends a lot of time around her child, that would certainly tell you that the seizures did not happen very, very often. Other than that, I can't glean any information out of that.
Okay, and would it strike you as odd or out of the ordinary for someone who's been treated as regularly as Zion was treated to have some kind of serious condition like this go undiagnosed?
Most definitely. As I said previously, she was no stranger to the healthcare system. I mean, she even went for her wellness checks, and a condition like this would have to be diagnosed and medicated, and would definitely appear in your problem list and in your medication list, so that any subsequent visits they would know, and in case there was like going to be any medications that are going to be prescribed new, that it doesn't conflict with what she already has. Some seizure medications also require maintenance levels. So it is strange, given how often she went into the healthcare system, that there's no diagnosis or anti-seizure meds prescribed.
Okay. And do you have any suspicion that EDS killed Zion Foster?
I question as a physician whether she actually had it when it's not consistently appearing in your records and in the records how the diagnosis was made and the testing. Without that, I doubt that she actually had it. If she did actually have it, she was clearly not having any cardiovascular symptoms, which would be the life-threatening ones. And with the vascular type that affects blood vessels, there are characteristic facial features that go along with it, and she did not have those. The valvular type, you can have valve prolapse and die suddenly, but that type manifests a lot earlier in life. So besides doubting that how the diagnosis was made, there was no mention of any of the other supporting things that would be needed that would indicate that she had it or that it was life-threatening.
Okay, and in your work over the past 26 years, have you encountered other cases involving the alleged disposal of human remains?
Yes.
You ever heard of anybody disposing of human remains to hide a death by COVID-19?
Objection, Your Honor. This goes beyond the scope. She's not an investigator. And
She spent a half hour trying to suggest she died of COVID. I think I can question it. Again, in your experience, you ever heard of somebody disposing of human remains to disguise or conceal a death by COVID-19?
No.
In your experience, have you ever heard of someone disposing of human remains to disguise or conceal a death by seizure?
No.
And hypothetically, when it comes to this commentary about shallow breathing and a faint heartbeat, is there anything else you can think of that could cause those symptoms?
Well, again, those symptoms just tell me that she was dying, and it could be if there actually is a condition that was not diagnosed or symptomatic, if there was drug usage and the circumstances as reported are not true, but that would also be the appearance of someone if they were suffocated.
So suffocation could cause shallow breathing and a faint heartbeat.
Yes, if the lack of oxygen has gone beyond the point where your brain cells are starting to die. Yes, again, shallow breathing and being unresponsive is essentially what all of us go through as we're dying.
Thank you.
Yes, thank you. Now, doctor, you stated that you were unaware of any anti-seizure medications, correct?
Yes.
It's possible that you may have overlooked whether or not there was a history of anti-seizure medications that were prescribed to her, correct?
Well, no, I didn't overlook that there was no diagnosis of it or monitoring or treatment. If it had appeared without a diagnosis in her medication list and it was in the list that I clearly missed with the fluoxetine, then yes.
So it's possible that you missed it, correct?
But again, not in the context of there was no diagnosis or monitoring of it. So I don't believe that I missed it in the medical records.
Okay, but you don't know what you don't know. So if you did miss it in the diagnosis, which is a possibility, you wouldn't be in a position right now to say that you missed it, correct? Correct?
Yes, I guess if I don't know that it was there, then I don't know that it was there.
And similarly, when you were asked the question at an exam prior today about there being a presence of antidepressant medication, at that point in time, you thought that it wasn't, correct?
Correct.
And you had the correct information at the time of your analysis, correct?
If that page appears in my medical records, then
Okay.
yes, it was there.
And it'd be fair that you were never given any additional medical records other than the ones you were previously provided at the inception of your analysis, correct?
That is correct. After the preliminary exam and the questions of you regarding antidepressants and seizures, I did ask if there were any other medical records, and I was told that I received all that they could find.
Okay. So the medical records that contain the information that there has been a history of antidepressant, you had those medical records when you formulated your opinion in your June of 2023 letter, correct?
Yes.
Now, you stated that you doubt whether or not she actually had EDS. I mean, you're not a internist, are you?
No.
Okay, you're not in a position where you diagnose individuals who may have Ehlers-Danlos syndrome, correct?
Correct.
Okay, and that diagnosis was provided on her medical records by a trained medical professional, correct?
Yes.
Okay.
However, it wasn't typed.
That information was contained in her medical records by a trained medical
Yes,
professional,
yes.
yes? Okay. Did you ever request additional information from that medical provider to find out whether or not, in fact, she did have Ehlers-Danlos syndrome or if it was misdiagnosed?
No, I did not discuss this case with anybody else. I simply asked if there were additional records.
Okay. So you're not in a position to, I guess, speculate whether or not this other trained medical professional actually misdiagnosed her, correct?
Correct. I just said that I had doubts and I would want to see certain things in the medical records.
Okay. And you could have contacted the medical provider who generated these records, correct?
Yes, I could have, yes.
Okay. And you did not do that in this particular
No,
case, did you?
I did not do that.
And you were not asked to do that in this particular case by the prosecution, correct?
That is correct.
Now, as far as individuals disposing of bodies, that goes beyond the scope of your job description, correct? Of why somebody might do something, correct?
Why, but how bodies are found and disposed of is unfortunately part of our job because we do have to document things. So yes, we have many cases where things have happened to the bodies after death.
Okay. My question is whether or not that information is disclosed to you as a possible reason why a body was disposed.
Yes, no, that is of no concern to me why a body was disposed. I simply document if it has been and again, what injuries, if present, would have been before death or due to how the body was disposed.
Okay, so when the prosecutor asks you, have you ever heard such as a case of somebody disposing a body due to COVID-19 or due to a seizure, you've never heard the reason why somebody disposed of a body under any circumstances. Would that be correct?
Yes, but I interpreted the prosecutor's questions as to has any person who has died from a seizure or COVID had a body disposed of or put into a dumpster, and the answer is no. The reasons why was not the question that I was asked.
Okay. Now, you stated that there would be facial features, I guess, associated with...
One of the two severe forms of EDS, specifically the vascular one, so that it's concerning because it affects blood vessels. There are characteristic facial features that these patients have. That would include wide-set eyes, a very sharp nose, thin lips, recessed chin, and no earlobes. And in the pictures that I have seen of Zion, she did not have any of these features.
Okay, and would it be fair to say that these particular symptoms don't exist in every individual who may have been diagnosed with Ehlers-Danlos syndrome, correct?
That is correct, but at least some, if not all of those, should be present in the variant that they're described in, which is the vascular variant. If she had any of the other variants, you would not expect to see those features.
Okay. And you stated earlier that an individual who went to the hospital stating that they can barely feel their heart, that could be a symptom of EDS, correct?
Well, yes, correct.
Okay. And it's also possible that at times hospitals fail to diagnose an individual with certain conditions, correct?
Yes, with particularly vague symptoms, it can be misdiagnosed or undiagnosed for a period of time, yes.
Okay. And a person who's epileptic, some of the symptoms are fatigue and headaches, correct?
As an indication that they're coming on, yes.
Okay. And a person can go to the hospital with these particular symptoms and be misdiagnosed, correct?
Yes.
Okay. Because there's a particular test that one must undergo in order to find out whether or not somebody has seizure issues, correct?
Correct. And if you're not describing symptoms that sound like a seizure, they may not be thinking of it. Correct.
Okay. Thank you. No further questions.
No, you're not.
Any questions from the jury? Please pass your question up to the deputy. Can anemia cause someone to pass out / faint? Does this look like a mild seizure?
Yes, if you are anemic, particularly like when you stand up or bend over, you can get dizzy, you can get lightheaded, and you can faint. And if that, I guess, persists long enough, then it could look like seizure-like activity, but usually no. But yes, passing out, fainting, most definitely. If you're anemic, the seizure-like activity, less likely.
Any follow-up questions based on that?
No, no.
And based upon your reviewing of the medical records, there was no history of her being anemic, correct?
I do not recall seeing that in her medical records.
Okay, thank you. No further questions.
Thank you, we can step down. We've been doing it, we'll just need a quick break.
Sir, what do you do for a living?
I'm a detective with the Detroit Police Department.
And how long have you been employed with the Detroit Police Department?
10 years.
And how long have you been a detective in the Detroit Police Department?
2 years.
And what's your current role as a detective with the Detroit Police Department?
I work in the cybercrimes unit.
And what's the sort of general scope of your duties in the cybercrimes unit?
We are tasked with cell phone forensics, computer forensics, as well as investigating child sexual abuse material.
Okay. And how long have you been in that role?
I have been in that role for 5 years.
Okay. And as part of that role, do you have any specialized training when it comes to cell phone forensics or computer forensics?
Yes.
And what sort of training do you have?
I've taken courses through the National White Collar Crime Center, as well as I was Cellbrite certified in conducting cell phone examinations and extractions.
Okay. And to be clear, this case doesn't involve cybercrimes, is that correct?
That's correct.
But were you asked to review a particular phone extraction to provide some technical insight into it?
Yes, I was.
And does your training and experience in cybercrimes enable you to provide some technical insight about the data associated with the phone extraction that you reviewed in connection with this case?
Yes, it is.
And have you previously testified as an expert in the field of cell phone or computer extractions?
I have not.
Okay. And so this will be your first time?
Correct.
And the sort of methods that you use when you're analyzing cell phone extractions or computer extractions, are those methods that you came up with on your own, or are those more widely accepted within the law enforcement community?
I'd say more widely accepted in the law enforcement community.
Okay. And in terms of your experience working on cybercrimes cases, and particularly child sexually abusive material cases, do you have to get into kind of the granular nuts and bolts of data that is recovered from cell phones?
Yes, I did.
Okay. And did you do that in this case?
Yes, I did.
Okay. Your Honor, I would pass for any voir dires to the witness's expertise.
Yes, a few questions. Hello, Detective. Now, you stated that you're an expert in cybercrimes, or what is your title, I guess, so to speak?
I'm a detective with the Detroit Police Department.
Okay. And what training have you underwent in order to make you an expert in, I guess, cybercrimes?
I've taken courses through the National White Collar Crime Center in cell phone extraction, extraction analysis.
Okay, cell phone extraction and analysis. How many hours of training did you go through on that particular subject?
I believe it was 20.
20? Okay. And did you receive any certificates after undergoing that training?
Yes.
Okay, and what certificates did you receive?
Just certificates of completion for the courses.
Okay. Did they call you maybe like a specialist, or was it like specialist 1, specialist 2? Is there a particular title that was bestowed upon you after undergoing those 20 hours worth of training in that particular area of extraction?
Yes.
Okay. And when did you undergo this training for cell phone extraction?
It was 2019.
2019. Okay. Are you required to take any continuing learning or legal education to keep that particular certification? Or is it just a one-time
It
training?
was just a one-time training.
Okay. Have you had any follow-up training since 2019 in the area of cell phone extraction?
Yeah, but we continuously go through National White Collar Crime Center to keep our skills sharp in.
Just keep your skills sharp, okay. Could you specify what type of training you would undergo in order to keep your skills sharp?
It's more, they offer different courses that different people go through, and
I didn't mean to cut you off. Could you just testify on what you specifically did, not others? What type of additional training or classes did you specifically take?
I can't remember the names of them. But it's multiple with the National White Collar Crime Center.
It says multiple with the White Collar Crime Center?
Yes, National White Collar Crime Center.
Okay. And do you know how many hours approximately you took?
I can't recall.
Okay. Can you recall the last time you took a class?
It's like 2-3 months ago.
2 or 3 months ago? Was this online? Was it in person?
It was online.
Online? Okay. Was there a test that was administered after this classes or training?
Yes, they usually test you afterwards to make sure that you've retained knowledge.
Okay, you said they usually. Did they do it in this particular situation?
Yes, they did.
Okay. And did you pass?
Yes.
Okay, is it a pass or fail score, or if you remember, or is it a particular percentage that one must achieve in order to pass?
It's a particular percentage.
Okay, and do you know what that percentage number is? 80%? Okay. Just roughly how many questions on the test?
I believe it was 10.
10. Okay, multiple choice?
Yes.
Okay. If you were to fail the test, could you then retake the test again? If you know?
Yes.
Okay, so you can keep taking as many times until you pass it, correct?
Correct.
Okay. And do the questions remain the same?
I believe they're in a different order.
Different order, but the same questions, correct?
Correct.
Okay. And the test will let you know which answers you got wrong, correct?
No.
They won't? Okay. Now, other than, I guess, cell phone extraction, what other areas are you certified in?
Computer forensics.
Computer forensics. Okay. Now, what type of training did you undergo in order to be certified in computer forensics?
I was also through the National White Collar Crime Center.
Okay. Was it a test? Was it a seminar? What type of, I guess, training was it?
It was similar to the cell phone training.
Okay. Do you know how many hours you had to complete in order to be certified in computer forensics?
I can't recall.
Do you know the last time you attended such a course?
I believe it was 2023.
Okay. Is that the last or the first?
That was the last.
Okay. What was the first time you attended?
2019.
2019. Okay. Is there a certain amount of credits that you must maintain per year in order to keep to be certified in computer forensics?
Not for those courses, no.
Not for those courses? Okay. As your part of your duties with the Detroit Police Department, is there a requirement from Detroit Police for you to keep a certain amount of, I guess, credits per year in these particular areas of cell phone extraction and or computer forensics?
No, there's not.
There's not?
No, sir.
Okay. And you stated that you've never been certified as an expert in a court case, correct?
That's correct.
Have you ever attempted to be certified in a court case and just have not been certified?
No, sir.
Okay. So this is the first time you're testifying and you're in the capacity of an expert?
In the capacity of expert witness, yes.
Okay. Now, are there any other areas other than the two previously named that you're certified in?
No, that's it.
That's it. No further questions.
Detective Frankie, if I could just ask a couple of follow-up questions. So, again, you've been in this line of work for how many years now?
5 years.
And this field of cybercrimes and cybercrimes investigation, is that what you're doing day in and day out, or do you have other duties as well?
That's what I do day in and day out.
Okay. And how did you make it into that particular field? What brought you to that field?
I am very interested in technology, and so I put my application in to be considered for the spot for cybercrimes.
Okay. Did you have any sort of computer science background before you put your application in?
No, sir.
Okay. And after you put your application in, it sounds like you've done some training on forensic imaging of cell phones. Is that correct?
That's correct.
And what was the other certification? It was computer forensics?
Yes, imaging, computer hard drives, and different other devices that store memory.
And how is it, I guess, in your daily job that you utilize those particular certifications and the training that you have?
Every day we image computers and different digital devices forensically, and then we process them through and make them into a human readable format.
Okay, and do you have experience analyzing those images once they're in a readable format?
Yes.
And is, again, I guess that experience that you have, is that based on the training that you receive in these fields?
That's correct.
And yeah, Your Honor, with that, I guess I'd move to qualify him as an expert in the field of forensic cell phone and computer extraction and analysis.
I wouldn't classify him as an expert. He may have experience. However, I believe due to his, I guess, lack of knowledge of his particular training and or what particular, I guess, thresholds are necessary in order for an individual to maintain certain certifications in these particular different subject areas, I don't believe he's qualified to be an expert in cell phone extraction in this particular case.
So do you undergo any proficiency? Have you undergone any proficiency testing?
No, sir.
Okay. Have you gone, are there particular programs that you utilize on a daily basis?
Oh, yes.
And what are those programs?
We use Celebrate for cell phone forensics and Magnet Axiom for computer forensics.
All right, and what sort of education training have you received with Celebrate and Maxi?
Celebrate, I have been certified as a Celebrate forensic examiner, and with Axiom I have not had any training, but I do have experience.
Okay. And how often do you Celebrate?
Every year.
All right, and how do you know that you're operating it appropriately if you haven't been proficiency tested?
Because I have received training for Celebrate in the past, and I have been certified in the past.
You have been certified. Who certifies you?
Celebrate themselves, the company,
And how do they know that you're certified?
because there's a course that you take for.
And is there an exam you have to pass?
Yes, there is.
And you passed that successfully?
Yes.
And are there follow-up tests or quizzes that you have to take to maintain that certification?
Yes.
And did you pass those?
My certification lapsed in 2021, so and I have not been able to recertify.
Judge, I'll just offer him as a lay witness, and I believe he can testify about, based on his experience using Celebrate, about particular issues that are posed here.
Okay, fair enough.
Detective, I want to show you, let me first ask you, in connection with this case, was there a particular, did you look at one particular phone extraction?
Yes.
And at the point you looked at it, what was the format that extraction was in?
It was in a Celebrate reader format.
Okay, and so you didn't actually do the phone dump yourself, is that correct?
That's correct.
Okay. But you looked at it once what we call a phone dump was created, correct?
That's correct.
Okay. And just showing you what's been admitted as Exhibit 72. Would this be the device information report for the phone dump that you looked at in this case?
Yes, that would be.
Okay. And do you see the evidence number reflected there on the exhibit?
Yes, I do.
And what was the evidence number for that particular phone?
Would you like the whole one or just the?
Just the
average number?
last two digits.
It's 89.
Okay, and I'm holding what's been admitted as Exhibit 61. Does that exhibit have the same evidence number?
Yes, it does.
And what's the description on that particular Exhibit 61?
Black iPhone, Apple iPhone in a green and black case belonging to Jaylin Brazier.
Okay. And I want to show you what has been marked, or rather admitted as Exhibit 73. Did you have an opportunity to review some of the web browsing activity that was identified in this particular extraction?
Yes, I did.
And I'm going to publish what has been marked as Exhibit 73A. If we look at this web history, starting in row 1, what sort of information do we glean from that?
The title of the web page, the URL, when it was last visited, how many
And
visits.
what was that title as reflected?
So
in
the
that?
title is My Cousin That I Haven't Seen in a While was pretty much like Zeta Grand Blue Fantasy No Kin.
And what's the sort of overall URL or web address that was visited in connection with that page?
Was allporncomic.com.
And what's the date of that visit?
The date of that visit was 6/4/2023.
Okay, and I want to scroll down to line 4. What's the title of the web page that was visited with respect to this particular data?
Together with my older cousin, Kenji Kishizuka.
And
Porn
what's
comic.
the overall URL associated with that that particular website or web page visit?
Allporncomic.com.
And what was the date of that?
6/4/2023.
You want to give me an approach?
Okay, and I want to move to line 7. What would be the title of that particular webpage?
The title is "Watch Me Fuck My Step Cousin on Her Parents' Bed."
And
X videos.
what's the overall URL for that webpage visit?
It's www.xvideos.com.
And just as a general matter, do you have familiarity with what the domain xvideos.com is?
It is a pornography website.
Okay. I'm going to scroll down to line 12. What's the URL shown for purposes of line 12?
It's xvideos.com.
And then is there a description after that?
Yes, it's me and my step cousin-in-law get caught fucking.
Okay. And is there a date associated with that particular visit that's reflected in this data?
Not reflecting this data, no.
If we go down to row 14, what's the URL that's reflected here?
xvideos.com.
And what about what follows the overall domain name?
Yes, it's /?k = +cousin.
And did you, I guess, familiarize yourself in the course of your work with this? Is there a search feature on xvideos.com?
Yes.
And if hypothetically one were to search xvideos.com for cousin,
Objection. This would be speculation. That'd be speculation.
I'm asking him whether he.
He's not an expert witness. I mean, for him
Well,
to
I
give.
think he's asking him if he visited the site when he saw it. Is that right?
He's
That's
asking
correct.
hypothetically, if you were to do something on a particular site, what would be the conclusion of that? But as a lay witness, I believe he can.
But
give
I
his
don't think
opinion.
that's the question, Mr. Brown. I think the question is whether or not he visited that particular site.
No, he asked them if it has a search engine and you type in this particular phrase, what would happen? That was the question. Am I incorrect with that?
No, that's exactly what I'm trying to ask. But I think he's qualified to answer that question. So if you went to xvideos.com and typed in the search term cousin, what URL would get reflected by doing that?
It would be similar to this.
You're right. I get it. That's beyond his scope of his expertise in this particular matter. He's a lay witness, and for him to give particular, I guess, his professional opinion on what URL would appear after typing a particular phrase, that would be upon his scope, Your Honor. And if he was an expert witness, then maybe he could give an opinion. But as a lay witness, Your Honor, that's beyond.
I don't think this necessarily even calls for expert opinion, Your Honor. I'm simply asking him to interpret this specific webpage by testifying if you were to go to that page and do this, would we get the same result? And that's based on his experience, and I don't think that calls for an expert opinion.
Okay, well, I'm not sure you can reach a conclusion if he hasn't actually gone to that site, though. I'll see.
Detective Franti, did in sort of in connection with your analysis, did you go to the site xvideos.com for this case?
I did not.
You did, okay. In your experience investigating cybercrimes, do you often find yourself investigating the significance of web domain names?
Yes.
And do you often find yourself investigating the significance of search history that is recovered in extraction reports like the one we're looking at right now?
Yes.
And in your experience doing cybercrimes investigation and in your training as a cybercrimes investigator, is there any significance to the symbol K equals?
And Your Honor, once again, this beyond his scope. He's asking him to testify as an expert witness upon his experience in cyber crimes, Your Honor. He's testifying as a lay witness, so that goes beyond what he can testify to, because he's not an expert witness.
I'm going to try to lay a little bit more of a foundation, perhaps, that he's got some education, training, experience in that area.
When you're investigating cybercrimes, is it important to at times distinguish between different types of web browsing activity, if you will?
Yes.
And when you're distinguishing between different types of web browsing activity, do you ever happen to find yourself investigating whether browsing activity is sort of like passive as opposed to being the product of a specific search?
Yes.
And can you kind of help us understand why might that be important in a cybercrimes investigation?
It would be important to show intention if the user actually generated the content versus if the computer is just generating the content.
And in terms of the daily work that you do as a cybercrimes investigator, Is looking for intention a part of that work?
Yes.
And what sort of, I guess, tools do you have at your disposal to look at intention, if you will, in a cybercrimes investigation?
We would just use the tools, the Cellbrite and Axiom, to go through and look at the different URLs that were visited.
Okay, and in looking at different URLs in other cases that you've worked on, have you ever come across a URL with the term K equals in it?
Yes.
And based on your experience in those other investigations, is there any significance to that term K equals?
Yes.
And Your Honor, once again, he's asking him to testify as an expert witness based upon his experience in phone extraction and asking him to come to a conclusion in this particular matter. And he's not an expert witness, so he cannot give an hypothetical opinion in this particular situation, especially when it goes to this particular information and the extraction of it, because he was not a part of that, nor is he an expert.
I think you have to lay a little bit more of a foundation about why an education trainee has being able to distinguish an intentional search versus a passive search before you can get into any answers.
Okay. Well, with respect, Your Honor, that is what I'm trying to do, and I think that the significance is this specific phrase that is in the URL. I don't know how else to ask this question. He's testified that he has come across this particular symbol, K equals, in previous cybercrimes investigations, and that based on his experience, there are implications that can be drawn from that. And I think he's fully equipped, even as a lay witness, to be able to testify about his experience with this type of information.
And he's also indicated that he didn't go to this particular site to do any type of, I guess, homework, so to speak, to verify the answer that prosecution is seeking.
So what sort of education training experience do you have that would tell you that K equals has any meaning at all?
There have been several cases that we've had where we had to look for user-generated search terms, and we don't have that.
Is that something that you've been taught on the job, or is it something you've learned in experience? I just don't understand how you know this.
Something that I've noticed a pattern when I looked it up to see what it meant.
How long would I ask that question?
Okay, so again, I guess based on your experience in cybercrimes investigation, is there any inference that you can draw from the existence of this term K equals in this particular URL that is in row 14 of Exhibit 73?
Yes.
And what is that? What inference can be drawn from that?
That was a user-generated search term. They had to click on the search box and type in that word.
Okay. And if we go down to row 15, what's the URL reflected in row 15?
xvideos.com/?K equals black plus cousin.
And we go down to row 18, what's the URL reflected in row 18?
xvideos.com.
And what's the body of the URL after that?
It's deep anal, my step cousin doggy, while my step aunt is not at home.
And then if we go through down to row 25, just as an example, what's the URL reflected there?
xvideos.com/?K equals real plus step plus cousin.
Okay, and Your Honor, recognizing that we're probably not going to conclude this witness today, do you want to keep going?
Yes,
Yes.
okay, we'll continue tomorrow. Send it back here.